is your pain level okay? Did you say that already?
Oh, yeah, absolutely. You know, I had all of the different kinds of pain that Jim was talking about. I had this pain here, which I don't remember the name. I had the pain here, I had pain here, and literally I would get up in the morning and get out of bed and be like this. And, you know, it didn't get much better, but it got slightly better after, you know, a couple of hours. But then, you know, once I started to do the exercises, I added the insoles, and it's like the pain doesn't exist anymore.
Okay, good.
Sir?
Have you had an X-ray on your knee?
Oh, yeah. I had an X-ray probably, let me see, I'm 75 now, so I had the X-ray when I was, I think it was like 60. That's when it was starting to hurt. And you could see there was no cartilage in the left, plenty of cartilage in the right. And the X-ray came when about the time I had a hip replacement. I had my right hip replaced in 2012, wasn't it? Yeah, 2012. He came to my house and took care of me. And so that's when so literally, you know, I don't have a copy of that X-ray, but it's literally, you know, there's bone on bone on the left, and plenty of cartilage, like a 1/4 inch of cartilage on the right.
So on your bone-on-bone knee, you still not get it replaced?
No, that's why I'm here. You know, that's you know, because of the way in which the exercise and all of the things that Jim has recommended, I've done, and it's like, well, if anything, I've put it off for a long time, and maybe, I hope, forever, that I don't ever have to have that knee replacement. Because a hip replacement is easy, no problem.
And I think that's a really big point. That's I touched on that earlier, but I think it's worth repeating over and over, is that X-rays don't equal pain. You can have, like, think of it as two different things. You have an X-ray diagnosis of arthritis, but you may not have arthritic pain. So if we did an X-ray on his knee, it would look exactly like it did 3 weeks ago, but he's not having pain. So, you know, if we have to keep that in mind. That,
So was the pain constant? Was the pain when you went up and down stairs? When, could you tell me about that?
It wasn't when I was sitting around, otherwise it hurt. And I moved, when I moved, it hurt. You know, sitting around in the kitchen, you know, and if I had to, you know, if somebody said, come on into the living room, let's do that, I go, okay. Get up and hobble my way into the living room and, you know, do that. So, but it was literally, no motion, no pain. Once it was in movement, it was painful.
So based on what I've said, can anybody figure out why the arch supports help?
Stops the pronation.
Yeah, it stops the pronation, and the pronation leads to the lower leg rotating out. So you get this at the knee. And so you get less of that with the arch supports. Thank you. So afterwards, it's hard.
Yeah,
I'm much better with like somebody, and I know what to do with them, and even then,
I
it's,
finished 3 months ago, so I'm,
Yeah.
you know, and I was better, and I'm doing pretty well, but you know, when you do
So-
the right things, or
yeah, so the general thing is to gradually increase. To try to find a level of things that you can do without making yourself worse, and then try to gradually increase it. So you mentioned elliptical. You know, let's say you could do 5 minutes on the elliptical without a problem, but if you did 8 minutes, it would be sore for the rest of the day. So then do the five minutes, and maybe once a week add a
Oh, I
minute,
didn't know you was so.
or add 2 minutes. Our body will get used to what we do, and it will accommodate or rehabilitate. It'll get better at doing what we do, and then we can do a little bit more.
if it hurts, do you stop, or do you try to push through and do a little more?
I would not try to push through it. There's some exceptions to that. Like if it's tight and it hurts to bend it, I would push through that. It's important to get the flexibility. But if, like I said, if the elliptical you can do 5 minutes, but 8 minutes hurts, I would go with 5 minutes. But I would try to continue to go back to the exercises that the PT gave you and, yeah, work on the ankle flexibility, work on the hip strength, work on the quad strength I haven't touched on at all. A lot of doctors will talk about that. That's kind of a thing from 20 or 30 years ago. It is important, but I don't find it as important as these other things. And this is a simplification. We look very comprehensively and we do a lot of different things. But this is the bigger picture of what we do. Yep.
Does clicking of the knee have any, is that part of the knee?
That can be from a couple different things. If it's just like non-weight bearing clicking.
What was the question?
Oh, is
Clicking. I
it-
have clicking on either side of my knee, and sometimes it clicks and I feel as though everything is moved into place after that.
Yeah, that's a good way to put it. So the question is about clicking in the knee. What is that, and is that a problem and stuff? So it can be a couple different things. It can be that the kneecap is slightly out of center and it's shifting back into the right place. It can also be tightness of the iliotibial band on the side, especially like non-weight bearing like that. If it clicks with weight bearing, like going upstairs or walking, that can be a small meniscal tear, or that could be a meniscal tear, some lack of smoothness in the joint itself. But if it's not painful, it's generally considered okay. I call it less than ideal, but not a reason to stop doing things or anything like that. If it starts to get sore, then to address it.
I was wondering how John, I think, knew what kind of insoles to get, because they must have different kinds of insoles, I would say, but
You want to talk about that? Yeah,
Sure. Okay.
where'd you go? And
What Jim recommended was going to, strangely enough, a place in Needham here called Nicholson's Shoes.
Oh, yeah.
And they sell a type of insole, which is what I have in here. And I wear every, it's kind of funny. I should probably buy another pair of insoles because I'm always changing them out and putting in different shoes or something. But anyway, so I got the insoles, about a week ago or a week and a half ago, something
yeah,
like
I'd say
that.
10 days ago.
And he said, get the $40 ones. Well, the $41 ones are now $50. And but Nicholson's fitted them, right to my foot, and then you kind of like you take the insole of the shoe that you're using out, you put it up against that insole, and it might be too long at the front. You trim it down a little bit, you stick it in there, and you start walking. And for the first couple of hours of using it, I said, I don't like this. But they said, do an hour one day, 2 hours the next, 3 hours, kind of make it progressively more, use of the insole. By the time I got to a week, I said, I'm not taking them out. They're not coming out because they just, it was like, I can't say it changed my life, but, it changed a whole lot of pain that I was having in that knee, and you knew how much pain I was having. So he's the one that said, get those insoles. So Nicholson's $50.
Money well spent. You should feel gentle support on your arch from your shoes or from insoles. It shouldn't feel like all your weight is on your arch, although it may be a transition while your foot kind of accommodates to it. It shouldn't be like you don't feel it against your arch. So I think with that brand, they have 3 different arch heights. Did that sound familiar?
They have the green and the blue.
Maybe
I don't
two.
think there was 2.
Maybe
but
2
I think
arch
the
heights,
green
yeah.
one was the high one.
And did they let you try on both of them, or?
No.
Okay, they just,
You said, get the high one.
get with the high, yeah, I knew your foot, so,
Yes, sir.
yeah. Yeah, and a lot of people think that they have flat feet, but when we put them into a neutral position, it actually turns out they have a really high arch, but it's just that it's really collapsed and rolled in. And that's really important.
Hi, I think I'm starting to get a bunion, and I was reading about it, and it said one of the worst things you can do is wear flip-flops, which is what I've been doing, and I wonder, like all summer, and I wondered if that can, it sort of seems to hurt my knee too, so we do advise against wearing flip-flops.
Totally, yeah.
Even though I got them at Michaelson's, and my podiatrist said, oh, those are good flip-flops.
Well, I mean, there are, like, they do make a lot, so what I'm picturing are kind of the old ones, you know, the floppy.
Yeah, these aren't flat, they have arch support and they're thick.
Yeah. I'd have to look at them to know, but it could be that you just don't have as much margin of error as you used to. Is it something that gets better in the fall and the winter when you wear other shoes? Like your knee pain, did that get better in the fall and the winter?
Well, it's bad right now, but it's because of a tennis injury. And I guess I also have a question about, what are they called? Right behind your knee, up above these muscles.
Hamstrings?
Hamstrings, when those get strained. I mean, and then that's what I'm suffering from now and with the knee and the hamstring. And I'm doing the exercise, I'm doing PT, but they don't seem to be taking a long time.
So I would bet that your hip is weak and it's because of the pelvic alignment, and not all PTs are, think that way or know how to fix that. So, and when there's a pelvic alignment issue and the SI joint is kind of stuck, it weakens some of the muscles, and then other muscles work harder and they get sore. There was I'm trying to think of, it's kind of a long story, I'm trying to think of how to make it small, but a PT in Australia who worked with the Australian rules football team, they had a big problem with groin strains. They'd have 125 missed games by their players due to groin strains. So it was a 1-hour podcast, they went through a lot of different things, but the bottom line is they found a correlation between the groin strains and weakness on the outside of the hip, which I never would have predicted because they do opposite things. So, like, if you think logically, they can't substitute for this. So why would they get sore if this is weak? But it's one reason why I try not to use logic too much, because a lot of times there's something else that we don't know that makes us miss the logic. But then they found a correlation between that hip weakness and the pelvic alignment and SI joint. And so they found this down there, and by working on those things, they reduced their games missed to 25 from 125, so 1/5 of the amount of games lost. So that would be my hunch on yours. Any other questions? Yeah.
So this therapy that you do,
Yeah.
sounds different than, like you said, not all PTs are knowledgeable in this. Is this like a specialty area?
Yeah, it's through those, there's 3 therapists, we've all taken 6 classes, and it's called Institute for Physical Art. They use things like PNF, which is proprioceptive neuromuscular facilitation, which is that neuromuscular re-education. There's a big emphasis on that. The joint mobilization and soft tissue mobilization. So the comprehensive word for that is manual therapy. So we have a lot of advanced skills in manual therapy where we can make changes in how the body works with our hands.
So I'm currently undergoing physical therapy for stroke recovery. Can I do this at the same time? Does Medicare cover that?
Yeah, Medicare allows, you can't have appointments in the same day. But if you schedule them on alternate days, you can go to PT at 2 different places.
Do I need a medical prescription for that?
Yeah, Medicare requires a prescription for physical therapy.
So that my PCP has to approve it?
Yep. I've never seen a case where they won't approve it, so. And they can just, if they're willing to give it to you without seeing you, you can just fax, you can have them fax it to our office, which is on the card, if you want to go that way. Yes, sir.
If you're bow-legged, does that complicate things?
Yeah, it's a little different. But it turns out to be the same real broad concept, which is figuring out where the mechanical deficiencies are and addressing that. And also it's, we think of it kind of like an